I think you can mute everybody.
Yeah. Hello everyone, welcome again to yet another Indo-Indians Health Event. This is an online event and we are very pleased to have with us Dr. Shilpa Dhoka. Shilpa Dhoka is a Ayurveda Acharya and she has been supporting us on many knowledgeable sessions to help our community members. We have been going through this pandemic now for exactly 2 years. It started on the 1st of March in 2020 here in Indonesia. And here we are right at the beginning of, at the end of February 2022. And this has been quite a journey. It has been strange times and we have all been going through very strange times. You know, the last year we had the Delta virus, the Delta coronavirus, which was incredibly scary. Many people got affected, many people experienced loss in their families, and some people are still struggling with the after effects of that infection. Over the year, there have been many variants of this coronavirus, and in Indonesia now, the Omicron virus has kind of exploded. Many people have been affected by the Omicron virus. It is incredibly transmissible. In fact, it is surprising how transmissible it is. We are always meeting our friends, we are meeting people around, and we are hearing from them about the struggle that they are going through with the Omicron. But we are very lucky that we've got vaccinated. And if we've got vaccinated, we are safe. In fact, we are safe because even if we do get the Omicron, it is not as bad as it could have been. So we will first go and ask Shilpa about what her view is on the Omicron infections and what she sees the symptoms to be, so that first we know what the symptoms are and how we can take it forward. Shilpa, over to you.
Thank you very much, Poonam. I would just like to first of all thank you, because doing this session is at the right time, because Omicron is at the peak in Indonesia. This is like officially it's a third wave, and so many of them are suffering through this infection, and some of them are out of it, still struggling with the post-COVID symptoms. So I think this is the right time you have organized this session, and I'm sure we can together help, like we can give some tips to get out of it. So now let's start with, I want to first tell you the difference between Delta and Omicron.
Okay.
So Delta, which was like last year, we were all talking about Delta. We were doing we were checking our oxygen rates, oxygen levels in the blood. That was the main thing that we were all of us doing. I think every house must be having at least one oximeter and the thermometer. But there is a difference. There is a biggest difference is like oxygen levels do not change with Omicron, number one. Number two, the taste and the smell, which was the biggest sign of Delta, that doesn't go.
Okay.
With Omicron. So these are, people keep on thinking we have fever, we have cold cough, but I can smell, so I don't have COVID. It must be just a normal flu, but this is different.
Right.
This is the main thing that people have to understand. Now, Omicron is a mutant from Delta, as we know that the COVID virus has been mutating, and as it mutates, we are finding different effects. The Delta was mainly attacking the pulmonary system, so the breathing system was affected. Now Omicron is attacking the muscular system, muscular skeleton. So every part in the body which is made up of muscles is going to be affected. If the muscles are affected, the bones are going to be affected. If the muscles are affected, our heart is going to be affected, because these are all muscular organs. So that is why the pain, when Omicron sets in, the infection sets in, people get very bad body ache, headache, and then comes the fever.
I see.
So okay. It doesn't always comes with a cold or a cough. That is like third symptom. Mainly it starts either with a headache or a backache, body ache. So, and then after that, as the infection goes up, as the inflammation goes up, then you can see fever. Then you will see a little bit of cold, runny nose, cough is the last thing to hear.
So how long does this last?
So yeah, to see it from outside, 3 to 5 days.
Okay. So after 3 to 5 days, is the person cured of the virus, or are they no longer infectious?
So 3 to 5 days, after 5 days, they are no longer infectious.
Okay.
But see, this is a pure viral infection. The virus is still fighting in the body. Thanks to the vaccination that most of us have gone through. Because of the vaccination, the symptoms are very mild. But we have to remember that the virus is still fighting. The body is fighting with the virus. What actually happens is when the Omicron virus is in our body produces a lot of cytokines. Now, these cytokines are pushing the body to produce pushing the immune system to work hard and start fighting. The cytokines which are produced in the body, they irritate the muscular system.
Right.
So that is where this thing happens. So even though the symptoms are not so, we feel after 3-4 days, I don't have fever, I'm fine. But the muscular system is still struggling inside, which we don't see. Only what people understand is, by the afternoon, I feel very tired.
Correct. That's one of the leading questions that we've received for this event, that post-afternoon fatigue is a major thing.
This is what happens. Actually, it takes 10 to 15 days for the virus, the infection to go down completely. The fight between the virus and the body to completely, body can take over the virus. It takes 15 days. So I totally feel that, after 5 to 7 days, you're free to walk in the house. It's okay. There's no problem. But when we say 10 days isolation, 14 days don't go out, it means because your body is going through this infection, it's fighting, protect yourself from other infections.
Right.
The immunity is low. If you step out, if somebody else has some other cold, cough, any other microbial infection, then you are prone to get it. And then again, your symptoms will go up, and then you'll suddenly say, I didn't have cough earlier, but now the cough has come back.
Right. So what about this negative PCR test that you can get after 10 days? Does that say that you are no longer, you do not have COVID, or does that give you a permission to start doing whatever you were doing before the Omicron infection?
So as far as the negative report after 10 days, out of 100 patients, I think only 10 to 15 patients are getting a negative report by the 10th day.
I see.
Because the viral fight is still going on.
Okay.
If somebody is really having a good, the antibodies are very, very high in that body, and then they will get a negative report by the 10th day. Otherwise, it takes 14 to 15 days. But if the report is negative, that means the viral fight has stopped now. You have covered it. So it's fine to you for you to go out, be little bit free. But if the readings, the PCR readings that we see, if it is still 31, 33, so you have to take care.
I see. Okay. So that's a very good distinction about whether you are, how your body is reacting to the infection. So that's great. When I was when we were taking questions for this event, apart from fatigue, so fatigue being one of the major things that happens after Omicron, how do we manage this fatigue? How do we regain our stamina and strength?
So see, as I said, the fatigue is coming from the muscular system. See, our body is made up of muscles, including our heart is made up of muscles. It's a whole muscular system. And Omicron is it's an inflammatory disease. The virus produces inflammation in the body. It produces inflammation in the muscles. So even though on the face you look fine because you don't have fever, there is hardly cold cough, you feel I have recovered. But because the muscles are being attacked and muscles have to work, there's a lot of fatigue in the muscles.
I see.
So the treatment has to be for the muscles. There are other parallel treatment we have to do,
yeah,
but the main treatment has to be focused on the muscles, for the muscles.
So what would that treatment be, Shilpa?
So that treatment has a variety of things. I would say taking good food, but mainly I feel exercise.
Oh,
Exercise will play a more important role than the food also.
so
Now,
what exercise? Walking maybe? Low.
no, so this is where the difference is. After 7 days, for the first 7 days, I wouldn't recommend any exercise from the day the infection has been, like, we have figured out there's an infection. For the first 7 days, just sleep as much as possible. Just eat and sleep, eat and sleep. After 7 days, just start with stretching exercises, nothing more than that.
So yoga, maybe very gentle yoga.
Yeah, yoga, gentle yoga, where there's only stretching, no Surya Namaskar, no
Mhm.
cardio exercises.
Right.
So for at least 5 to 7 days, just do stretching. If you feel comfortable, you can do the stretching twice a day. Basically, we have to allow the muscles to recover.
Okay.
So first start with stretching, then start with weightlifting.
Hmm.
See, even if you're at home, if you're not, don't have access to a gym or something, but yes, you can like 1 kg packet, there can be a salt packet, sugar packet. Just try lifting weights. That will help. We don't have to start with cardio exercises, because this is the biggest problem. We feel walking is the safest exercise,
Yeah, that's true.
but cardio is the last thing I would recommend. So cardio should come only after 10 to 15 days of recovery.
Okay.
If
So
you're
you
just
are saying do simple, gentle stretching exercises. Once after a week, 10 days, you should start with weight exercises. You can find many body weight exercises on YouTube. You can do the gentle ones as you grow your strength.
Yeah. So then after that, we of course then you can start the cardio exercise. When you start the cardio exercises like walking, treadmill, Surya Namaskar, start with smaller, like 10 minutes, 5 minutes. Listen to your body. If you feel tired, you have to train the muscles. It's important, but don't do it on the first day. Don't think that, oh, I used to walk for 45 minutes, 1 hour, I used to walk 5K. I have to start that immediately. I'm fine. Listen to your body, let it recover slowly, slowly. That will help.
Right.
After this, of course, yoga will help, like meditation, like breathing exercises.
Yes, this is my point, Shilpa. I also got some questions where people asked about pranayam
Mhm.
and other breathing techniques. What is that role in a post-Omicron recovery?
So again, now see, breathing exercises also involves the lung and it also involves the muscles.
Hmm.
Okay, so Kapalbhati is strictly prohibited
Okay.
because Kapalbhati is strenuous to the muscles, so we should not do it. Lom Vilom is very good. Brahmari is good. Normal breathing in and breathing out is good.
I think maybe you should repeat that again, Shilpa, about Kapalbhati to be not to be done.
Kapalbhati is very strenuous. It uses a lot of abdominal muscles and it gives strength to the chest muscles. We should not do Kapalbhati at least for a month after you had Omicron. Let the muscles recover, then we can slowly introduce Kapalbhati. Forget that you were doing it earlier regularly. Your body is now has to get ready for it. You have to give it time.
Okay. I think that's very, very clear. Thank you, Shilpa, for sharing those very important tips. Shilpa, there's another effect is the brain fog. You feel like you cannot concentrate. There's lack of concentration. There's lack of when you say कि किसी चीज में मन ही नहीं लग रहा है. How can we get over that brain fog?
So again, brain fog happens because when we bring the Ayurvedic concept here, the brain fog happens because the one of the doshas, Vat, Pitta, Kapha, that's where the brain fog happens. And so the best thing here is apply oil.
Where?
Oil on the head, oil. You see, I know we cannot get a massager to get the massage. So apply, just do oil bath. The
Oh,
more
okay.
oil you apply, it will help you.
I
There
see.
is too much of vat, which doesn't allow you to focus.
Okay.
So just, it's a very simple technique. Of course, we can use Brahmi tablets. There are so many like single nutrients. We can supplements, Ayurvedic supplements. But the easiest, staying at home, easiest is just oil bath, applying oil, keeping it, and then, it helps a lot. I think oil bath helps a lot. Of course, chanting Om also helps a lot.
Right. I think that's also a very good thing to. Sorry, I'm so sorry. Shilpa, I think I muted you by mistake because there was somebody raised a hand. Can you unmute yourself, please? Shilpa?
Yeah, I have unmuted myself. You can hear me?
Yes, I can hear you. Yes, Shabana, you raised a hand. Shabana?
Yeah, Shilpa, I wanted to know because my daughter is going through this concentration problem. So you just mentioned oil. Any type of oil, or you recommend some particular oil like lavender oil or something like that? या
So,
किसी भी चीज का कोई भी ऑयल आप इस्तेमाल कर सकते हो?
so the best oil would be the sesame
Any
oil.
particular oil? That's my question.
Yeah, so best oil is castor oil with sesame oil. Castor oil is very sticky. So one portion of castor oil and 3 portions of sesame oil mixed together will give you the best results. And you can also use essential oils in the diffuser. Keep it in the room. It will help in reducing the brain fog and help in concentration.
Thanks. Thank you. That was a good question. Shilpa, the other thing that we've got, some other questions that we've got is about vitamins, about supplements. What is your view on that, post for recovery, post COVID?
So again, see, because like I am again and again going to speak that it's a musculoskeletal problem. So vitamin D plays a very important role.
Okay.
So everybody should take vitamin D as much as possible. Vitamin D supplement when you are going through the infection, 2,000 per day is good. If you're already covered out of it, then at least 60,000. Maybe you can take it once in 2 weeks, once in a week, depends on the body condition. But vitamin D is the most important thing. After that, zinc, vitamin C, vitamin D are the important things.
So supplements are something that is that you can take to help with your recovery.
Yeah, it speeds the recovery.
Right. What about, some people have spoken about sitting in the sun? What is your view on that?
Sitting in the sun, again, the absorption is not going to be that high, because sitting in the sun, we will sit at our leisure time. Sitting in the sun never gives you vitamin D. If you really want to absorb vitamin D, it should be walking in the sun. And there's a specific time, that is the early morning sun before 8:39. You don't have.
Shilpa, we are all dressed, we are covered, and especially when we go in the sun, we put on a cap, our face or our bodies are not even exposed to the sun.
Yeah, that's what I said, that it doesn't, we feel that, oh, I do a walk, but it doesn't help. The body cannot absorb enough vitamin D what is needed.
Yeah, so there's just a comment here about zinc. You just mentioned that zinc is also a supplement that we should take.
Yeah, zinc helps the muscle fatigue to go faster. So zinc is important.
Right. Okay. Thank you, Shilpa. That was about supplements. Now, I also wanted to check about other things, like there were some horror stories about having a heart attack after recovering from post-COVID, this Omicron. So is this due to the muscle thing again, like that you mentioned?
So here, I want to say, see, Omicron is not a very old virus, right? It's just 29th November was the first day when Omicron was announced all over the world.
Correct.
And it's not even 29th February yet, like 28th February, not even. So it's hardly in 3 months, 4 months. So there is not enough research. But the researchers that we have seen till now is saying that Omicron is not that damaging towards heart as compared to Delta.
Okay.
Just a shocking information that I'll tell you, till date, the researchers are telling us that still 63 to 64% infection is Delta.
Oh, I see.
And like above 40-45% is Omicron. But because we are vaccinated, we don't realize that. We are thinking that everybody who's getting it now is Omicron. So yes, as I said, because it's a muscular system attack, and because it's the heart, of course, there are chances that the muscles get weak, and that's why you have a problem. But it is not proved, so I wouldn't want to comment on it. But with Delta, there was clotting issues. That doesn't happen with Omicron.
Okay, I think that's a good distinction, and that we should remember that the Delta is still around. It's not disappeared.
Yeah, that's why I said, we should not start with cardio exercises immediately, because the heart is again going through fatigue. Give it time to prepare.
Okay. Shilpa, another question we got is, why is my blood pressure still high, 150, 100 after after the infection?
So see, this is something, it is difficult to answer on a general forum, because it's person to person's body. We don't know what the infection, whether it is really Delta or is it Omicron. We are just, because everybody at this point are self-treating. I would say 95% are self-treating at home, assuming it is Omicron. We don't know what it is.
That's
so one thing I will suggest, this is a sincere suggestion to everybody. It's okay to treat yourself. That's fine now. But after you recover, after 15-20 days, please go for a basic blood test to make sure everything is in normal range, so that you don't miss out on something. You don't just take it as a normal flu. It came and it went and I'm fine. You don't know what the body has gone through.
I think that's a very important point, Shilpa, and I would like to repeat it again. So everybody who has just recovered from COVID, after 15-20 days, please get a basic blood test done to see your basic parameters and to know that you're fine.
Yeah, so as far as the blood pressure thing is concerned, I would say that it is something which one-on-one can be sorted out. It's very difficult to speak at this point.
Okay. What about cough? After this, some people have a very long cough. For a long period, they still have a cough. How do they manage that?
So normally what happens is, I said, Omicron doesn't give you cough.
Okay.
It doesn't give you, it's not a symptom of Omicron. But, people within 3 days when they're weak, and they are like, after that, when they come out or they start the food that they take, after 3 days, they suddenly think they're fine. They start taking very spicy food. Or also there is one more thing, everybody has this, okay, you've got a COVID infection, start taking ginger tea, start taking spices. All these things triggers too much of acidity. It gives you acid reflux. And that's where the reflux produces an infection.
Right.
So it's rarely, I wouldn't say that it doesn't happen. Rarely there is a respiratory tract infection with Omicron.
Okay, so this is a byproduct of the infection.
Yes, but so still, if somebody is suffering, like if the cough is there, I would say tulsi. Make a juice out of the tulsi leaves, mix it with honey, take it 3 to 4 times a day. Even the licorice powder with honey helps. Or just chewing the licorice stick will help. It will basically clear out the throat infection. From the throat infection comes the lung infection. So if you make sure the throat infection is clear by the time, then it won't go to the lungs.
I have also heard from friends that now they are taking antibiotics for the cough.
Yeah, so if they have not cured the throat infection on time, see, one of the symptoms for Omicron is that there at times there's irritation in the throat.
Right.
Now, when there's irritation in the throat, and if there's a lot of acidic food taken, lot of warm food, because it's very common to take steam.
Right.
It's very, very common to take steam. So steam, because people think that it is going through the nose, it's going through the mouth, let us clear it. When you take the steam, the irritation in the throat increases.
Oh, I see. So we are doing the wrong thing by steam inhalation.
Yeah. So, once in 2 days, once in 3 days, if you take steam, it's different. I recommend steam for some of my patients, but I don't say that do it every day, because you are increasing the irritation of the throat and you are inducing the cough.
Right. So there was a comment just now where somebody wanted to know what you spoke about cough, and Shilpa, you mentioned that one should take tulsi juice with honey, or maybe licorice, just stick the licorice stick, we can just chew on it or suck on it, so that will help to dissolve if your cough is very bad, one can see a doctor and start taking antibiotics.
Yeah.
Okay. Now one of the most important thing is, what is this stick? Okay, licorice.
Licorice in Hindi, it is also called mulethi, yashtimadu. There are different names.
Okay. Now the most important thing is diet. At the end of the day, we need to know what to eat, how much to eat after post-COVID. Some people lose their appetite. They don't want to eat. Some people see no difference in their appetite and they continue eating whatever. But there must be an optimal diet that will promote healing back to their perfect health. What would you suggest, Shilpa?
So see, any infection in the body, any inflammation in the body will create, some people will get the symptoms where the digestive fire is disturbed. Some people might not get the symptoms, but there is for sure disturbance in the digestive fire. The enzymes in Ayurveda, we say Agni, and in allopathy, in modern language, we say the enzymes are disturbed. So the basic rule is eat light food.
Okay.
Eat light food, eat freshly cooked food, eat less spicy food, eat warm food.
I see.
So this is the basic principle. So avoid red meat, avoid processed food. I would also say plain milk should be avoided because
All dairy.
not full dairy, I would say, but plain just milk, direct milk or direct yogurt should be avoided, because milk and yogurt also induce mucus.
I see.
So, but if somebody really wants to take milk, then you can add a pinch of ginger, boil it, and then take it. Then the mucus, it doesn't induce mucus beyond that. And if yogurt, if somebody doesn't have any cold or any cough and still like everything is good, then yogurt can be taken, but then you have to mix a pinch of cardamom.
Okay. I think
Without that,
very
you cannot
important
do.
points. So if you're having milk, if you really want to have milk, boil it with a piece of ginger. If you want to have yogurt, add cardamom powder to it.
Yeah. So one more thing that I would like to specify here is, see, do not overdo with oil, ghee, cheese. But that doesn't mean that do not take it also. Because, too much of oily food is going to produce nausea. Similarly, if you take excessive spices, including turmeric, garlic, ginger, this is said to be, oh, you've got COVID, start taking this, you'll be fine. Again, if you take too much, there will be acidity, the throat will get irritated. So don't do that. If you take too much of beans, thinking that, oh, my muscles are getting weak, I need to take proteins. If you take too much of beans, there will be a lot of bloating. The body cannot digest it. So please make it light.
Right.
Make it light, take smaller portions, eat frequent meals so that your body can digest it. That's very important.
What about fruits? Because there is also this suggestion that have lots of oranges. So some people are overdoing it with oranges. What is your suggestion?
Again, orange is a citrus food.
Yeah.
It is acidic. So when there is an irritation in the throat, when you take too much of oranges, it increases the acidity, it increases the irritation.
Right.
Which, directly nobody realizes it. So my suggestion is eating a bowl of fruits is better, and the fruits can be apple, pear, simple common fruit, which is good to digest, lighter to digest. A bowl of fruit, if you really feel low in energy, you can surely take a fruit juice also or a smoothie also. But, so fruits, I would say it's like an energy boost. Because I feel inflammation, this is an inflammatory disease. So sugar should be avoided as much as possible. So if you really feel low in energy, I think fruit is a good idea.
Okay. Sushma has raised her hand. Yes, Sushma, what is your question?
Hi. Actually, I had suffered from Omicron, and I still I have recovered, but I still have my ear. There's some irritation always in the ear, and occasionally it pains also, and it itches a lot. So, is there anything we can do about that, or it will just gradually it will go away?
Okay, it is something personal, but okay, because you've raised it, I will answer it now. I feel there is an acid reflux, and that is creating inflammation in your eardrum. So if you take acidity, like the food that can reduce the acidity, or maybe you also need some medicines to reduce your acidity, immediately the reflux will go down and the ear pain will go away. You don't leave it just like that. You just get it checked and get it treated, because it will not go by itself.
Okay, thank you so much.
Talking about sugar, Shilpa, that you just mentioned, that it is better not to eat sugar. Some people have said that they now experiencing a sugar problem. Maybe they've become pre-diabetic, or their blood test shows that they've got higher sugar. What do you attribute that to, and how can they fix it?
So, because again, it's an inflammatory disease, the body is fighting with the inflammation, the sugar will go up. Anybody who is pre-diabetic, who is diabetic, their sugar will go up. we have to be very careful with our food intake for the 3 months, 2 months, it will come back. But if you, like, if needed, sometimes you also have to increase the medicine dose, but it will come back. It is the body is fighting through it, so it will go up.
Right.
Nothing to be worried, but you have to be careful.
Yeah. I had also checked with my questions when I had, for this session, I had asked if people had any suggestions about what has helped them with this, managing this process. So some of them said that eat a lot of eggs. What is your view?
Yeah, eggs are good. Eggs do help. Like protein, eggs are good because they give good protein. Even chicken soup, chicken is good. Fish is good. Only I would say avoid red meat and processed food.
What about salt water gargling?
Not so. I'm not in favor of that so much because it produces irritation in the throat. Better is betadine gargling or honey gargling is better than salt water gargling. Even ghee gargle is better compared to salt gargle.
One question we got was that they've got a cracked tongue.
Cracked tongue can be reason of either it's the patient is constipated or there is a lot of acidity. So it has to be individually checked.
I see.
Or maybe vitamin B deficiency also can be there. So it depends, we cannot just.
What about drinking warm water all the time?
Again, warm water is going to increase the throat irritability, and that's where you're onsetting cough for that. So lukewarm water is still okay, but cold water is for sure you cannot take. But I would suggest either room temperature or lukewarm water, not hot warm water.
Okay. So in fact, I think you've answered all the questions that we have received. Do you have any final thoughts? And then maybe we can open it up to 10 minutes of Q&A to the audience that is present here.
So I would just say, we have all learned in last 2 years that whatever the COVID virus has come and it is mutating, and nobody on the earth knows when it is going to stop mutating. And I think we should accept it and we should learn to live with that it will mutate. This is not, even though the scientists are saying maybe this is the last Omicron mutation and this is going to close, or this is the antidote or whatever, this is the dot or whatever. But I feel that it is going to mutate and it is going to live with us. And we have to learn to live with that.
Yeah.
Don't think that Omicron is mild and okay, it's just 3 days of infection. It's okay. I'm fed up of sitting at home. Let me go out and get it overdone with it. Because I have seen people reaching the hospital and the extreme happening. They never came back home. I have seen with Omicron also. People are lucky who just got cured in 3 days. So please do not, I wouldn't say that, please do not explore. Don't be too brave with that. If it comes, don't panic. You can manage it, but that doesn't mean that, okay, I want to get it anyways, I'm going to get it. Why not I get it and do it? Because, it is impacting your body.
Yes.
It is impacting your body and the losses are there. It is going to harm your body. So why invite the losses? So I would say be careful, be guarded always, but be ready. You don't have to stay in anxiety. What is going to happen?
Yeah.
Because 2 years is a long time and the scientists have already learned how to manage it. You can also see, when Omicron came, it was a panic, but within 15 days, we all came to know that it's not difficult to handle it.
Correct.
So even if a new mutant comes, I'm sure the scientists can manage it. So don't panic, but don't loosen your guard.
I think that's it. Keep following your health protocols, safety protocols, and be very aware of what actions you are taking.
Yeah, that is very important.
So Shilpa, can we open it up to Q&A maybe for the next 10 minutes? And if anybody has any questions, maybe they can raise a hand and we can listen to them. Or if they have any comments that they'd like to share with us. Anyone? Actually, Shilpa, whatever you said was very comprehensive. We in fact managed to answer all the questions that were sent to us. We also shared all the comments that had been raised. And I really thank you for taking this time out.
Yeah, I just want to add, like Ayurvedic supplement like ashwagandha. I would say that if anybody is in the middle of the infection or just started, ashwagandha does help a lot. So, anybody like who's in the middle of the infection can take ashwagandha tablets 3 times a day, 2 times a day. It helps recovery. Like, I think this is also will help many people who are still in the middle of the infection, or if they're still recovering. Start with 3 tablets of ashwagandha, and then you can reduce it day by day. So ashwagandha, shatavari, chavanprash. So these will give energy. Chavanprash would be the last thing I would want somebody to take, but it will help. But ashwagandha, shatavari, triphala, these things will surely help. So these are again some nice Ayurvedic things, and which is commonly available now.
Right. So thank you so much, Shilpa. That was a very informative session. Thank you so much for sharing, and for everybody who's sent their questions and their comments. Thank you for participating. If you have any other questions, you can reach out to us through our WhatsApp or our Facebook. And please do download the Indo-Indians mobile app, which is now new and improved. And I look forward to bringing you more informative events like this in the future. Thank you, Shilpa.
Pashi has raised her hand, I think. She wants to ask something.
Sorry if there is time. I just wanted to thank you so much, Shilpa and Poonam, for this forum. A lot of things were not known, although we think we are very net savvy. I have 2 questions. One, when my daughter had COVID, she was okay after 24 hours of fever. Do you also recommend that she gets a blood test done after 20 days as recommended for us? The second question is that how do we are in line for our booster dose. So as we are now I'm recovering from COVID. When do you think is the right time for a booster? Because I took my second vaccine in April in India.
Yeah, so as far as the blood test is concerned, I think your daughter should also go for it. It's whether it's a 1-day infection or it's a 3 days infection, everybody should go through the blood test, because the internal body condition can only be seen through the blood test.
Okay.
So, it doesn't harm in any way. It just gives us a surety that everything is good. So for sure, that is very important, and get it done. And as far as Omicron is concerned, for now, I think after 1 month, this is what is being said. After 1 month, you're allowed to take the vaccine because it doesn't have a problem. But as research has come up, we will have more clarity.
Okay, thank you.
Okay then. Thank you, everyone. Thank you for joining.
Thank you, Poonam.
Thank you.